Borderline personality disorder is a mental illness characterized by unstable moods, behavior, and relationships. There are many signs and symptoms that may suggest a person is affected with this disorder. These symptoms include extreme reactions to abandonment, patterns of intense or stormy relationships with loved ones, often varying from extreme love to extreme dislike, distorted or unstable self-image, impulsive or dangerous behavior, suicidal behavior, self-destructive behavior, intense mood swings, chronic feelings of emptiness or boredom, anger problems, and stress-related paranoid thoughts, including losing touch with reality. To be diagnosed with this disorder, one must show signs of at least 5 of these symptoms.
It's extremely difficult to deal with someone who hates you one day, likes you the next day, and could love you the third day. This is a group of people who emotionally respond much more sensitively to things. In other words, they respond to some small thing when for you it might take something big. So that's just an emotional vulnerability factor. The second thing you have to know about them is not only do they respond to a very small event, they respond very rapidly.
Although exact causes for this disorder remain unknown, scientists agree that the disorder stems from a variety of factors, including genetics, environmental factors, and brain abnormalities. Some studies show that the disorder can be inherited. Other studies show that borderline personality disorder is commonly found in those who have a history of childhood abuse, neglect, or separation. Further research shows that a lack of or malfunction of the brain chemical serotonin, which regulates mood, can cause borderline personality disorder.
Someone can say something to me and I can have a severe reaction, and then 2 minutes later I can have another completely different severe reaction. And so it's just constantly, in the course of a day, it's incredibly exhausting.
They are, in my opinion, the ultimate outsiders.
They oftentimes try to conform to what they think other people want from them.
This disorder can be treated through multiple means, including a combination of the following. Psychotherapy is usually the first type of treatment patients will undergo, whether it's one-on-one or in a group. There are 3 main types of psychotherapy that are used for people with this disorder. Cognitive behavioral therapy to identify and change core beliefs, dialectical behavior therapy, which emphasizes awareness, and schema-focused therapy, which focuses on the way people view themselves. There is no medication approved to treat borderline personality disorder. However, many people with the disorder take medications to help with certain symptoms of the disorder, including anxiety, depression, and aggression.
Borderline personality disorder is really a serious illness that we do currently now understand as a medical disorder that probably affects about 1% of the population.
There are over 200 ways in which borderline personality disorder can show itself. The disorder is often found in combination to other disorders like depression, anxiety, bipolar, and more. The stress and lack of stability that this disorder provides often leads to self-harm and suicidal behavior. The family of an individual with this disorder often feels helpless and stressed out dealing with this disorder. They can sometimes feel responsible for this disorder since it's often linked to the environment. The high level of stress in the household often lead to other health problems. To get help, you can go to this website, which is based in Portland. If you think you may be affected by this disorder, you should talk to a social worker, doctor, or other trusted adult.